Well, we turn our attention now to news from the mid-year budget debate in the House of Assembly. No significant budget cuts nor major increases in projected expenditure. But 6 months into the current budget cycle, and the Ministry of Health is not without its challenges. The Bahamas is in the midst of a post-COVID-19 crisis, a frightening reality, but one health minister, the Honourable Dr. Michael Darvall, attributes to an increase in chronic non-communicable diseases. You know, like heart disease, diabetes, hypertension. And that's mainly in the case of middle-aged and elderly Bahamians in need of extensive hospital care. What's worse is that increased demand for hospital care is putting a strain on the ministry's resources and the delivery of its services.
Many of these unstable patients require hospitalization because of non-compliance with medication, diet, sometimes lack of primary health care follow-up, in many cases resulting in readmissions just weeks after being discharged. Mr. Deputy, this was becoming a vicious cycle because these chronic patients continue to occupy precious hospital beds, making it extremely difficult to admit surgical, medical, obstetric, and gynecological patients who in most cases have been on waiting lists for years to have life-saving, non-urgent surgical procedures completed.
That's the problem. What's the solution? Well, according to the minister, this entails what he calls an aggressive patient education, community nursing, and strong wellness programs.
As well as to use digital monitoring devices that would detect and red flag patients with uncontrolled diabetes, unstable congestive cardiac failure, renal impairment, and this would allow us to move swiftly to stabilize these patients at the primary health care level, preventing unnecessary hospitalization.
That, however, not the only challenge to overcome. For years, the healthcare sector has been plagued with manpower gaps that has led to continuous recruitment drives for more medical specialists and nurses. Regarding the latter, Darvall announced the recruitment of nurses from Ghana, Cuba, and the Philippines.
3 specialist physicians from the Republic of Cuba who are expected to be in country in a few months. 2 ophthalmologists and 1 radiologist will join the PHA team this budget cycle, enhancing our hospital capabilities to provide cross-training opportunities for physicians. Over the next few months, my ministry plans to engage another 8 biomedical engineers, 2 respiratory therapists, 12 lab technologists, radiographers from Cuba to fill the gaps at our reference lab, expand services at our polyclinics in New Providence, our Princess Margaret Hospital, and the Rand Memorial Hospital.
The minister adding that as soon as the process is complete for the trained clinical nurse curriculum and accreditation, 100 students will be enrolled each year for the next 3 years for an 18-month program, scheduled to start in the second half of the current budget cycle. Well, construction costs have swelled in recent months, but if health officials are serious about improving overall patient experience, infrastructural upgrades are key. Here's the health minister providing an update on where things stand with the Rand Memorial Hospital.
Our architects, our health planners, engineers have completed the first phase of the design-build hospital, and requests for proposals will be going out this month as part of the tender process for the construction of the first phase of the $201 million new state-of-the-art hospital on a new greenfield site promised to the people of Grand Bahama by our former administration. I fell in a ditch, but God has given me a second chance.